Here are a few tips for when conducting the opportunistic medication reviews. So we have here the basic screen with the patient's repeat lists on. So first question is, are they taking the medicines? There's two ways of looking at this. If you highlight the medicine listed, down here on the template details, there's days between issues. That will show you how often they've been having it. So this patient's having 60 tablets. If it was listed as one a day, that would last 60 days. So you'd expect this number to be 60, and it will list the last 5 issues. And that will give you an indication how often they're ordering it. So it will fluctuate a bit. It might be like 58, 62, but it will give an indication. If you wanted more information on that, a bit more of a detailed history, if the numbers don't make sense, for example, if you right click on the medicine, then go to information and go to show information history, this will show you all the issues that have been made for that medicine. So, and that will show you going back as far back as the records go. So this is quite useful if you need to challenge a patient who says they're taking it every day and you're not convinced. This will show you that they maybe last year only had, 5 months supply or 6 months supply, and it's quite useful to have that as backup evidence. Also check the duration box. So this is also on the repeat template, and check that makes sense with what's on here. So if we look at the ibuprofen as a better example, that's 3 times a day. There's 84 tablets, so the duration is 28 days, and that's correct. Also, when you're doing the review, just check that they're up to date with their long-term condition reviews, blood tests, and blood pressure checks. If you also see that they're having any acute items on a regular basis, and that doesn't have to be every month, it could be every 2 or 3 months. But if you see they're having something acutely on a regular basis, just think, can that be put onto the repeat list? And just add it on. But no, the pill and HRT medicines currently don't go on the repeat list, and that's practice policy. This will help the prescription team tremendously because they get about 100 tasks a day, mostly for acute items, many of which actually could be on repeat. If the patient's got any as required medicines, any PRNs, make a note in the new journal as to how often the patient's using them. That's more useful for future medication reviews if we see that their use of GTN, for example, is increasing. Also check the nominated pharmacy. So up in the top right corner, check that with the patient that it is correct. These things do change. So you just need to hover over it and it will tell you which the pharmacy is. That's especially important for patients new to the area where their pharmacy may not have been updated. So once you've done all that, you then left click on the icon here, which is record medication review. So that will read code that medication review has been done. And then the icon next to it, the green arrow, if you click on that, highlight both items and click on that, that will bring up this box. The review date defaults to 1 year. If you want that to be differently, you just change that. And the review quantity should match in. So if the hydroxychloroquine, if that is a 2-month supply, that would be 6. Ibuprofen is a 1-month supply, so that would be 12. You may wish for them to be the same, in which case just change the quantities. And that is the very basics of doing a opportunistic medication review. Thank you.